at our mandates. We should look at tort reform here in the state of Maine. We have to allow doctors to be doctors and not to be defensive in how they treat people. We need to not, we have a Cadillac taste, but we have a Chevy wallet. We need to take a hard look at what we've done. If we looked at New Hampshire, for instance, and adopted their mandates, had a high-risk pool for the chronically ill so they don't fall through the net, lower our premiums for insurance, then the 289,000 people on main care or the people that are in the system could come back to the private system. I know Elliot and Libby love the government system, love the big government. I don't believe that's necessary. I think everybody wants to blame the insurance company. If they don't blame them, they don't pay the hospitals. So they're the bad people. Or they'll say the big corporations. Let me tell you the big corporations. We have 36,000 companies in the state of Maine. 35,800 had less than 25 employees. Maine is not a state of big corporations. Maine's a small entrepreneurs that hire small people, a small workforce, and we need to support them and not put them into a system they can't afford.
Elliot Cutler.
Paul, Martin's is a big employer. You employ, I think, 1,200 people. At least 100 of them are on Medicaid, main care.
Because everything goes to the private sector.
It's because no, it's not. It's because you don't pay them enough, and it's because we have a system. It's because we have a system. It's because we have a system in the state of Maine, just like we have a system nationally, that's built around health insurance, as though health insurance was some necessary component of a sensible health care plan. It's not. Competition among insurance companies, you can go to California where there's the most competition in the country, and their rates are rising just as fast as ours. You can go to New Hampshire, and if you're young and healthy, you can get insurance, but if you're not, forget it, or at least you're going to pay more than you pay in Maine. We've got to take hold of this system and focus on what will really work. Focus on wellness, focus on prevention, focus on creating relationships between providers, doctors, and patients, and say to the insurance companies, you have a role in our system, but you're not going to be central, because right now we're paying 20 to 30% of every dollar we spend on health care in the state of Maine is going to overhead, administration, profit of insurance companies. That's not necessary. And you know what else isn't necessary? It's not necessary that we ought to be spending 60% of everything we spend in the state of Maine to take care of diseases that were chronic or preventable, because we're not taking care of ourselves and we're not incentivized to do so. All of this can change. If you look at our Maine Wellness Plan, you'll see how we propose to change it. It makes sense, and it's going to provide access to essential health care services for everyone in the state of Maine at a cost we can afford, that we can sustain over time, and that is incentivizing both providers and patients in the right way. And it's going to create a healthier workforce, and each of you will have a medical home.
Mr. Scott.
Yes, the situation with Derigo, a two-tiered system, absolutely an example of something that doesn't work. What happens is we created a pool for a certain class of people and then made that pool exclusive to those that qualified based on income and things of that nature. What we didn't do was make that a solvent, long-term, viable investment policy by putting 15,000 state workers and 186 legislators and one governor into that pool. This seems to be a fundamental problem. Thank you. It's absolutely true. It seems to be a fundamental problem. We're really not leveling the playing field between the private sector and the public sector. Now, healthcare is, a huge national issue, and we all get that. So to sit up here and suppose that we know all of the answers, but it's important that you just understand a little bit tonight, about how we think and how we solve problems. As far as our national healthcare plan, right now, 3M and McDonald's Corporation are both working with the Attorney General of the United States seeking waivers to exempt themselves from that plan. So that's a problem. because they have, in McDonald's case, their in-store employees, they have 30,000 employees, and they're just no longer going to insure them if this system is imposed by the Fed, because they have their own insurance policy that they've worked because of the volume. And it's interesting, down the end here, I think Libby mentioned the self-insured, so that's going to be a huge problem for Maine. It's just a matter of time, and I know this now through the McDonald's and the 3M example, that probably we're going to have some self-insured companies in Maine seeking a waiver like that too, so the next governor's going to have to be out in front of that. Luckily, I'm fully informed right now. The other situation is, well, my wife told me to try to lighten up a little, so, and she's always right. The other situation is the prevention. I talked about an agricultural policy when we opened this thing up tonight, and imagine a situation where we're feeding children K through 12 healthy foods and working on that path. Childhood diabetes, gone, or at least being worked on. So that gets us in all those directions. Thank you.
Going last, I mean, there's been a lot of great comments, and I'm going to later on to what's been said, but I call it look the other way leadership. Instead of fixing the real problem, we kind of started something new, and they wanted to take that chance, want to take that risk to do that, but think about how many lobbyists there are up in Augusta. That's a sobering reality. There are lobbyists up there that lobby for interests. And this is a perfect example of where the system isn't working because of that. So we did it with workers' comp. There's no reason in the world why we can't do it with health care in the state of Maine. But we've got competing interests that we've got to push out of the way and do what's right for the people of Maine. Our gal that's been working here at the shop with us for some time, her husband's passed, Dick Haskell, but he was on that Blue Ribbon Commission. He was a partner of Lucas Tree. And workers' comp has gotten to the point where the companies were leaving in groves, so they decided to form their own co-op, and that was what happened. Those business folks got together, and that's what became the Blue Ribbon Commission. So we've done it before, we can do it again. Take Dirigo Health, roll it into an exchange. You can't just cut that and let those people fall out of the nets, if you will. But problems get solved when you take out the special and competing interest. It really gets so much simpler when you get around the table and you can just work on what's best for everybody. And that's what, government and politics has become today. There's a lot of forces acting that we don't see because it flies in the face of common sense when you think about it. You have to have over 50 people full-time in this state to get an experience-rated plan in the state of Maine, which incentivizes you to have wellness programs and HSAs. And we do that in our company, and our costs have gone up minimally over the last 3 or 4 years, but we're a larger employer. The small business community with under 20 people, 10 people, don't have experience-rated plans. So it'd be like trying to insure your car and not be able to run someone's driving record. How do you rate the risk? We've got to change those mandates, and we've got to overhaul healthcare.
We have time for one more question, but I'll have to ask the candidates to keep their answers to 1 minute. And the question is, by many measures, Maine taxes are high. If you had to pick one, and please do pick just one, which tax would you seek to lower first? The income, sales, or property tax, and why? And we'll start with Elliott Cutler.
I'd try to lower the income tax. I've said I would like someday to be able to lower the income tax, the marginal rate of the income tax, by more than half. And the reason is because it's important, I think, to follow the principle of taxing consumption and not savings and investment, particularly in a state like Maine today, when the thing we need most is investment. We need investment from people who are living and working in Maine. We need investment from people outside Maine whom we want to invest here. We need investment. And I think that the signal that we would be able to send that we've cut the marginal tax rate by more than half would be a signal heard everywhere that Maine is doing business differently.
Mr. Scott.
That's a tough one. It's property tax, absolutely. And the reason for that is because we can get at that real quickly when we start funding education at the level where it's supposed to be funded from the state, and we can do that with efficiencies and lean practices and lots of different methods. We can work really hard over a 2-year period and make certain that we're increasing that commitment from the state without raising taxes. increase that commitment to education, that will lower our property tax. Property taxes are brutal. I mean, elderly folks, property owners, it's just not right. They're really growing disproportionately to our incomes, things of this nature, discouraging people from continuing to stay in their homes and really, frankly, making it most difficult in some cases. In the town of Andover, where I do live, our property tax has come down a couple of mils through the hard work that we do, where if we don't spend money in our budget, we actually get it back. It goes into surplus. So, you know, property tax is really, really important to me.
Mr. Moody.
Well, everybody's heard here tonight, you know, $1 billion shortfall, $400 million, $500 million road deficiencies. The thought of realistically saying that we're going to do anything to lower taxes at any scale is, to me, it will be almost like a campaign. You know, we're going to do this, we're going to do that. The reality is we're going to work cut out for us. And if we can hold the line on taxes over the next couple of years, that's a pretty ambitious goal in itself. Because we all feel the pinch, we all feel the weight of the tax burden, but realistically, at this point, we're going to have to do everything that we can within our power to hold the line on all the taxes across the board, especially the property tax, because our elderly, they're the generation that wouldn't ask for anything. They're tough, they're resilient, they'll turn the heat down before they'll ask for help. So property tax is certainly a priority.
Senator Mitchell.
Thank you very much. It is true that we would need to reduce the income tax to stimulate business and to make sure that we can grow here in Maine, because we're out of line with our neighboring states. When we made the effort to reform the income tax, and it was in a tough budget year, it was called the Maine Miracle by the Wall Street Journal, because while other states were increasing taxes, Maine did not, and we were still trying to think ahead to invest for the future. Voters rejected that plan, so certainly we would not go back to that one, but we need to at least start looking incrementally and working toward getting that income tax down as soon as possible. First of all, it's not even progressive anymore. People are kicked into the higher bracket at a very low rate of income. Obviously, I share the concerns about the property tax too, because of the burden it has, but that's going to take a collective effort from municipalities and counties as well as the state. So we do have our work cut out for us, but income tax was my number one.
Paul LePage.
I think you can help lower property taxes by stop fooling Maine people, by stop unfunded mandates, like emptying a state prison and putting them into county jails, where county jails are paid by property tax owners. I think that's despicable. It would have to be the income tax. If you lower the income tax, particularly on pension, people on fixed incomes, you send two messages. One, that you are open for business and you are thinking ahead. And most importantly, if you raise that base and you take income tax off pensioners, what you're doing is you're lowering your DHHS costs as well. Because in one way, we take it in one hand and we give it back out in the other. And we see it all the time. As the mayor of Waterville, I see it all the time when it comes around for tax payments.
Well, Mike Ballesteros, president of the Greater Bangor Region Chamber, is coming on. And as he comes out, I'd like to thank our candidates for a very informative and very civil discussion. Thank you so much.
The Bangor Region Chamber of Commerce would like to thank each of the candidates for participating this evening. Thank you. And also would like to thank our sponsors again, Rudman and Winchell, the University of Maine, and Tussin University. Please have a pleasant evening, and don't forget to vote on November 2nd. Thank you.